No matter where in the world you are, the coronavirus or COVID-19 has probably had some impact on your life already. Every day, news outlets have new information and new things to worry about. Depending on where you are in the world, you're probably wondering, how far is this going to go? And what type of impact is it going to have on my life in the longer term? And the more and more I read news articles and engage with social media about COVID-19, it's really brought to my attention how much anxiety a lot of people have about what's going to happen with the coronavirus and how it's going to impact their lives. In today's video, I'm going to dive in deep with social distancing, the recommended way that healthy individuals can help curb the coronavirus and flatten the curve. As the days go by, it's recommended more and more that we engage in social distancing or separating from the larger group gatherings that we would typically engage with. But what does that mean? And how do we keep our sanity and mental health and well-being throughout this time when we might feel more isolated than normal? Of course, we want to be doing our part in being socially responsible with how we interact with our community during this really challenging time. But how do we also take care of our own mental well-being at the same time? In today's video, I'm going to be diving deep into social distancing and how you can engage in self-care during this challenging time to help maintain your own mental health. I'm Meredith McKenzie of Parallel Wellness, where I'm a registered clinical counselor. On this channel, we explore topics that bring clients to our therapy practice every day. You'll find tips and strategies that you can make your own to enhance your everyday life and manage your mental wellness. So subscribe to the channel and hit the bell in the corner so you're notified when we post new videos. We publish every Wednesday. So I tend to start off a lot of my videos with a disclaimer, and this video is going to be no different. I really want to make it clear that I am not a medical professional. I'm a registered clinical counselor, so I do not have any experience with treating the coronavirus, and I'm in no way qualified to make any kind of comments about the treatment of coronavirus and your symptoms and that type of thing. However, as a registered clinical counselor, I do work in the community with individuals with various mental health challenges, and the more and more we hear about the coronavirus and we see it on social media and we talk about it with our friends and family, the rate of transmission of communication is so quick these days that we receive this information really quickly. We're expected to process it really quickly, come up with a decision of how we're going to act. And at any time where there's any kind of uncertainty in our world, it's normal for our anxiety to go up. And so the more we've talked about the coronavirus and the uncertainty of when is it going to, break out into a pandemic stage, when is it going to impact my city, am I safe, are my family members safe, what should I be doing to be helping out in this situation and to be socially responsible with how I engage in my community, the more we talk about it, our anxiety increases and increases and increases. And that's just a normal response to it. And I think for a lot of people that I've spoken to, they're kind of riding this fine line between wanting to be informed and wanting to be smart and careful with what they're doing, and at the same time not wanting to jump into a more kind of anxious or fear-based response to what they're doing. So it's difficult right now because we definitely want to take the coronavirus seriously, and we want to be doing what we can to help prevent so many people being impacted by it. And what the media has been talking about now is about flattening that curve so that while people are going to be impacted by the coronavirus and that the virus will be transmitted, that the more we can, disengage from these social settings where we're just not a part of them, the less likely the virus is to spread to others. So as people talk about it, there tends to be a lot of fear, worry, concern, and a sense of urgency that we should be doing something, and what is it that we should be doing. And this video really is going to be focusing on what can you be doing to help care for yourself. What can you do to care for your own mental health, your well-being, your mood, and all of those things when you are engaging in social distancing. Because I think social distancing adds a second layer of fear and anxiety for people when they imagine not being able to engage with their world in the way that they would like and feeling restricted by that. And so I'm hoping that this video is going to be able to provide you with some ideas of how you can make the most of this time, and maybe some ways that you can actually add to your life with a form of self-care. Another cautionary note that I want to add to this talk is that the people that I'm talking about, or the people that I'm aiming to provide this video information for, are people that are healthy individuals, people that don't have compromised immune systems, people that are not elderly or really young, or that they're, maybe at risk of contracting the coronavirus, as well as not people who have already contracted the coronavirus and are really needing a full-blown quarantine of themselves. I'm talking about kind of the average person that's wanting to do their part, wanting to do some social distancing so that they're able to, you know, prevent that spread of the virus, but that they still have the flexibility and ability to do some of the things that they typically would do because they're not sick or in fear that they may catch the virus. This would also apply to people that are not worried about other family members that they're living in close proximity to or expecting that they'll be coming in close proximity to, that they may contract the virus to them. So as with any type of self-care, I think it's important to recognize that there are several domains or areas that we can be focusing our attention on in order to, you know, benefit ourselves on a more holistic basis. My first tip for managing social distancing is to have a plan. And now I don't mean to excite any kind of fear or anxiety in anybody where they feel like they have to be, you know, quickly trying to pull together this plan. I know that probably a lot of people are already out there doing that, really concerned and actively engaged, and there's that sense of anxiety that comes with planning. What I mean by having a plan is that when we're unprepared, or if we have idle time that we're not really sure what to do with it, it can cause a lot of discomfort, especially when you're feeling as though you're isolated within your home environment or that you're not able to do the things that you typically would do. Imagine for a second any other night when perhaps there is a large storm and when you lose your power at home and you suddenly realize, well, I don't have my phone anymore because it's not charging, and I don't have the television shows that I would normally watch, and I don't have the food that I would normally cook. So what I mean by having a plan is trying to think of some of those things. If you were idle or if you were expected to be home for a number of days on end, what would you do and how would you, entertain and fill your time? And again, I'm saying I'm not wanting this to be something that creates more anxiety or a feeling that you need to be doing more than you already are, but I'm really just suggesting to give it some thought of how you would like to use that time. If you know that your workplace is asking you to work from home, or that you know that you're not going to be attending, the regularly scheduled events or classes or groups that you normally would do, how are you going to spend that time and how can you really enjoy it? What everybody chooses to do during the social distancing time is going to be completely unique to them, but I think having a plan is something that we can all do. Now, touching on that kind of concern that I have that some people may really get caught up in the social media and the news outlets and all the things that they're, giving to us on a very quick and regular basis, is to recognize where you land in that. How much anxiety does this coronavirus, the COVID-19, create for you? And does engaging in social media help that? Or do you find that it's something that actually increases your anxiety the more that you engage? I think listening to a few very neutral news outlets could be helpful as long as they're not kind of promoting that big fear-based message. There's a big difference between knowing the facts and what the medical professionals and the government have recommended for us to do, and engaging in social media where everybody is giving their opinion of what would be best and making suggestions. So, trying to weigh out what is factual information that I'm getting from the news outlets and what are things that maybe I want to avoid, because I do find that they actually increase my anxiety and worry about what's going to happen. So this is a really good opportunity for you to kind of be a critical consumer of the media and take a step back maybe from engaging in social media, watching videos, and reading articles about the coronavirus. Social distancing is a newer concept that a lot of us are now more familiar with because of the coronavirus and what that's going to mean to our lives. Essentially what social distancing is a removal of yourself from the kind of community environment. Typically in our day-to-day lives, we probably come across tens to hundreds of people depending on our work environment and the type of activities that we engage in. Not to mention the amount of times that we maybe go to a location, we maybe touch some things in that environment, and then we go off and some other people will touch that as well. So when they're talking about the coronavirus and this social distancing, essentially it's taking a step back from life, taking a step back from the activities that you would typically do, possibly staying home and working from home, keeping children home from school. And a lot of the communities now are taking steps to, implement different strategies to help families and individuals to feel more comfortable with doing that, as well as to just kind of make it a precedent that this is what we're all doing. We are all engaging in social distancing. I don't know if I'm the only one here. I'm a pretty introverted person, but even this idea of social distancing over many weeks at a time, possibly months, seems incredibly daunting. Even for myself, I'm just imagining, what does that look like? Am I going to be able to see my friends? Am I going to be able to see my family? Am I going to be able to take part in the things that interest me and the hobbies that I have that make me feel good and help balance the stress of everyday life? And, have a moment. I don't know if I'm the only one here. I'm a pretty introverted person, but even this idea of social distancing over many weeks at a time, possibly months, seems incredibly daunting. Even for myself, I'm just imagining, what does that look like? Am I going to be able to see my friends? Am I going to be able to see my family? Am I going to be able to take part in the things that interest me and the hobbies that I have that make me feel good and help balance the stress of everyday life? So if you're feeling any of those things, it's a very normal feeling, and I'd encourage you to leave a comment in the comment section down below. I'd love to talk to you about how you're managing social distancing and how you feel about, taking a step back from your everyday life in order to help everyone else get through this time. So on that note, I'd like to talk about self-care during social distancing in the social realm, because many of us are used to either, engaging with friends out in the community, going over to one another's houses, and a lot of that is going to change as we continue to engage in social distancing. We're actually incredibly fortunate to be living in such a technological time when we do have access to cell phones and video cameras and, webcams and the smartphone cameras that we have, all of those things that are going to help us engage with our community on a virtual level. During social distancing, all the platforms that you use for video messaging and text messaging and voice messaging are going to be your best friend, because that's going to be how you're going to be able to communicate with your friends and family, as well as maybe even reach out to other groups that you want to be able to still be able to communicate with or engage with while you're trying to stay home. The really wonderful thing about technology is pretty much any social activity that you would do together, you can also do online. The important thing to recognize here is that even though you're socially isolated and you're not able to be one-on-one with people in the real world, by being able to connect with people over the internet, you're going to still be able to meet a lot of those needs that you have to be able to be socially interactive with others. And I think for a lot of people, that idea of not being able to connect with other people brings them a lot of fear. And video chats, voice chats, even text messaging are some really great ways to connect with people. And it just takes a little bit of creativity about what you're going to do while you do meet. Maintaining your health during social distancing is another area of self-care to look at. Yes, we're talking about preventing the coronavirus transmission, and if any medical symptoms arise for you, that's obviously an important thing to be checking with your doctor, but there are other aspects of our health that we need to think about when we're engaging in social distancing. For one, and this one might be more dependent on the area of the world that you're living in and what you have access to, but if you're able to get outdoors, whether that means that you have a secluded backyard where you and your family can spend some time and you know that you're not going to come into contact with other people, or you get in your car and you drive off and you go for a hike, that might be a really great way to still engage in the world outside of your home, so you're not feeling so cooped up, but you're also not engaging with other people. So it's really important when I make this suggestion that, it doesn't mean that you're stopping off at, to get a Starbucks coffee on the way and then you're going for your hike, but you're going directly from your home to the outdoors. You know that there's a lot of space between you and other people. You know that you're not, leaving any germs anywhere, that you're able to enjoy the outdoors, do something that feels like it's part of your normal routine and gives you an opportunity to burn off some adrenaline and cortisol that you may be building up because of this stressful time. Being active outdoors and just being able to get away from the home could be a really great way to still engage in social distancing, but also get your needs met for physical activity and being in the outdoor space. Again, I don't mean to be alarmist in any way, but something that's been on my mind, considering that we're not exactly sure which businesses are going to be staying open and which businesses may close, I think that's also important to have a reminder for anybody who is on any kind of medication, specifically if there are medications for mental health challenges, that, checking in with your doctor and getting a renewal of that medication, or making sure that you've gone to the pharmacy and that you've filled the prescription and you have it at home, might be a really good idea, because you don't know if you are going to contract coronavirus, and then in that case you really don't want to be out in the public and you don't want to be getting anybody else sick, but you also don't know how long you're going to be indoors. So having an adequate supply of your medications, so that you know that you've got what you need, so that you don't end up running out or going out into the community when you don't feel like you're healthy enough to do so, that would just be a good thing to kind of check off the list, that's one less thing that you have to worry about. One real benefit that I'm seeing of social distancing is that in everyday life, I don't know if you're the same as I am, but I repeatedly say to myself, I need to get more sleep. Tonight I'm going to go to bed earlier. I really want to wake up refreshed and ready for the day. And how many times do I say this and then not actually follow through? So if you are in a situation where your social distancing also involves partially like a quarantine, or that you're working from home, home, you know, I think that's a really great opportunity to focus on your rest and relaxation, to do something really beneficial for your health and well-being. This is a great opportunity to have an earlier bedtime, to have a nap, to really be able to focus on letting your body have the downtime that it might be missing out on. So it might actually be a good thing to stay home sometimes. So jumping off the point about getting medications, quite a few clients that I know, as well as many of the therapists that I know and work with, are now starting to question, what are we going to do about our therapy in the time that we're expected to engage in social distancing, and maybe we're making choices for ourselves that we're not going to appointments and that we're not going to see our therapist on a regular basis, even though we legitimately may need to. So I would recommend that you reach out to your therapist. A lot of therapists have access to encrypted video software so that they're able to speak with you online, and that you know that the information that you're providing to them is safe and encrypted and it's not going to be shared with anybody else. Ask about the availability of virtual sessions or telephone sessions, or however you can interact with them to maintain your therapy while you're engaging in social distancing. If you're like me, there probably have been times where you've said to yourself, if only I had time, I would do X or I would do Z. Well, that's exactly what this social distancing is providing you with. Extra time, or time that you would otherwise be doing things engaging in the outside community, that you're able to stay home and take some time to focus on some of those other interests that you have. I put a request out to the followers on my Instagram account. If you're not already following me, it's at Parallel Wellness, and I'd love to have you follow and we can chat. But I put a request out to the group there and said, like, what would you be doing if you were engaging in social distancing or if you were expected to self-quarantine? And I had some great suggestions. One of the suggestions that was made was, this is a great time to pick up the Marie Kondo, The Art of Tidying Up approach, and to really dig deep into your home and to do some organization and to cut some things out. That's a project that takes a lot of time, and you know, if you're at home already, that could be something you could chip away at. There are also so many learning opportunities on the internet. For one, and I think you can get a free trial of this, but Skillshare, like if you want to learn anything from photography to drawing to filmmaking to cooking, like anything your heart desires, they have it on Skillshare. This is not at all, you know, sponsored or an advertisement or anything like that. It's just something that I've been thinking for myself. And you know, there's the classes on there that if you have the time in your home, wouldn't it be nice to be able to learn a new skill or try something out that you haven't given a try before? There are also lots of places online, and you might want to check in if you're somebody that usually likes to exercise or you're a part of a specific group. A lot of the gyms that I've been seeing posting online are saying that they're going to be planning on doing some kind of virtual workouts, or you can even go on YouTube and, you know, follow some yoga routines or other workouts that you want to be able to do at home. But it's supposed to really just give you a sense of normalcy. And what would a self-care list be without a discussion about self-care in the most relaxing form? So another person that I talked to on Instagram actually recommended a home spa day. Like, this would be a great time to be, you know, doing a face mask, painting your nails, doing all the things that, you know, take a lot of time and you want to maybe relax and just enjoy it. And if you planned that into your calendar, if you had the time to take to really invest in some self-care and to, you know, pamper yourself and help yourself relax, that's a really nice time to do it. So I know in this video, the suggestions that I've been making have been quite adult focused or maybe even teenager focused. And this was something that I also saw on the internet, and I think is probably more intended for children. I'm totally going to take advantage of this. I've got a link and I'm going to put it down below, and it was a list that was curated of all the different virtual things you can do and explore, and they call it like virtual field trips. So you can go to the San Diego Zoo, or you can go to the Boston Museum, and you can go and see all these different places virtually from your home rather than having to go to them in person. And I know quite a few people whose plans for, you know, the spring and vacations and travel plans have all really changed and had to be canceled. And so maybe this is a way that you can actually go and explore the world and see some different things that you'd like to learn more about from the comfort of your home while you're still engaging in social distancing. I know this is a really difficult time for a lot of people. It's filled with a lot of uncertainty, maybe some fear of what could happen next and worries, and it's hard. Definitely it's hard. I'm really hoping that from this video you're able to get a few ideas of how you can manage that time for yourself while you're home and while you're engaging in social distancing, so that you're making the most of it, so that you are, you know, getting something out of it, that you're meeting your needs for social connection or physical activity, or, you know, to spark your creativity or intellect. And it doesn't have to necessarily be outside outside of your home so that you're able to be socially responsible and help out the community by staying home. So if you have any other ideas of how people can engage in social distancing but enjoy it to make the most of the time that they have at home, leave a comment in the comment section down below. I'm really hoping that this can be a space where we can have a good conversation about what everybody's doing to be supportive of one another. And if you do have any, concerns for your mental health, I always have a list of resources in the description box down below. Please do not hesitate to contact one of them if you're in the BC, Canada area, because I know that it's going to be a hard time. So if you like this video and you know others that are engaging in social distancing, send it to them. We'd love to have other people see it. Give it a like, subscribe to the channel because you're not going to want to miss any future videos. I'm going to be focusing for the next little bit on self-care and all the benefits of self-care and how we can engage in self-care in a really easy and accessible way. So make sure you subscribe to the channel so you don't miss any future videos. And I'll see you next week.